We're here with Diana Haynes. Diana, why don't you tell me a little bit about how you started doing body work and a little bit about your history?
Sure. Well, I began doing bodywork over 33 years ago, which is pretty amazing. And it was one of those coincidental things where I walked by a store, a massage center in Palo Alto, and it was advertising for massage therapists. And I thought, well, I can do that. And I walked in and they said, well, you can apply for the job, but you need to be certified. And I didn't have certification. So I just enrolled in the program and got the job. And much to my astonishment, it was something that I had a natural instinct for. And, you know, I didn't expect to continue doing it for 30 years, but it was something that gave my clients so much relief and gave me so much satisfaction that I just kept adding to my training and studying, gosh, thousands of hours of different programs, because I have a very eclectic sensibility with body work. And after about 10 years, I started teaching, and that became an even greater passion than doing private sessions.
So you've been teaching for almost 20 years.
I have been teaching for over 20 years, yes.
Wow. Now tell me all the styles of bodywork that you teach.
Well, I've taught a full 1,000-hour curriculum at my school, so I've taught quite a few different modalities. The basic massage, Swedish massage, therapeutic massage, advanced therapeutic massage, deep tissue massage, neuromuscular massage, sports massage, anatomy, physiology, pathology, business and ethics and marketing skills, positional release, lymphatic massage, yoga massage, communication skills for body workers, and healing intimate trauma. So working with trauma victims with therapeutic touch. That's a rundown of some of the courses that I've taught.
So you have a little bit of a range.
A little bit of a range, yes. Yeah.
If you were to give a therapist, a beginning therapist, some recommendations on a few points that would help to make their massage really good, what would those be?
Pay attention to the feedback that your client is giving you. I think too often we go in with a mindset of what we're going to do, the technique that we've just learned, and we want to practice that technique on our client. And we stop paying attention to the degree that we should to their feedback. Oftentimes clients won't tell you if something is not meeting their needs, if the pressure's too great, if the pressure's not significant, not adequate for what their needs are. And you have to respond to the subtle cues that they give you and keep asking. And I basically make the assumption that unless the pain is gone by the end of the session, I haven't done my job thoroughly. So that's probably why I've continued to do so many other trainings, because there's always a better tool for a particular person.
So in your sessions, you're working and then you're dialoguing with the client and asking them how the pain is after you finish working or retesting.
Yeah, the one kind of massage I never did was spa massage, where you just do a nice, relaxing massage. And I sometimes do that on friends and family just because it's a treat to not be doing diagnosis. But today it seems like more people are coming with specific injuries and underlying conditions, and they expect or hope at least that the massage therapist is going to be able to address that. And so yes, I do talk with them. I do a client intake and I talk with them throughout the session, and I explain to them, if they come in, say, with 2 or 3 specific complaints, that in addressing those 2 or 3 specific complaints, we may not cover the whole body with a relaxing Swedish style massage. And what I found is that if you address those complaints adequately, they'll come back. That's why they've come to you in the first place.
Yeah, that makes sense. Okay. So tell us a little bit about what is positional release and how does it fit into your practice?
Positional release is essential to what I do because it's the single most effective modality that I know to take a hypersensitive area of the body from 10, meaning, you know, acute sensitivity, down to barely noticeable within a minute or so. So the benefits of that are obvious, because that reduction in sensitivity is not just temporary. This is usually a decreased sensitivity that persists after the session. They may need another session or two to totally alleviate the sensitivity or strain pattern that they had. But in most cases, one session will clear strain and pain out of the area that was injured or traumatized. So it's absolutely invaluable. The other thing I was thinking about in positional release is that it's not something that's foreign to us. It's something that we do ourselves with our own body instinctively. Just think about the fact that when we curl up at night to sleep, almost all of us go into fetal position. In fetal position, we're contracting all of the primary flexors on the front of the body, which are the muscles that we use all day long in work and in our posture. And at night, we go into a position that releases all of that tension. And I don't know about you, but a lot of people bring a leg out to the side and curve around that side, and that would address low back and psoas on that side. So the postures that we find and create for ourselves just in making ourselves comfortable are positions of release. And then falling asleep in that state allows the body to neurologically reset itself so that when you wake up in the morning, those muscles have been reset to normal resting length.
Okay, cool. So is positional release easy to integrate into other treatment protocols, or is it something you have to do by itself?
Well, I studied orthobionomy, and it was taught as a separate modality. It was taught where you don't want to integrate it with other modalities. That's how it was taught in the 80s when I studied it. However, when I did further research and discovered positional release in the classic osteopathic training, they encouraged integrating it with other techniques, particularly stretching. And cross fiber, a gentle form of cross fiber, is the technique that I employ to find the trigger points that you want to release. So I invariably start with a gentle cross fiber, do the positions of release to ease the sensitivity, and then stretch the tissue afterwards, and then often do some kind of Swedish effleurage strokes afterwards for further integration and vibration. So yeah, it's very easy to integrate. In fact, I think your client's receptivity to this modality will be enhanced if you do integrate it with other modalities.
Great, thank you so much. That's Diana Haynes, and she's got a new video out on positional release. Thank you.
You're welcome.